Med Chains: Innovative Solutions for Pandemics. Written by Eyong Ebot. Narrated by Mark William Blessington. This book is dedicated to my two beautiful daughters, Ariel and Arlen, and my lovely wife, Cynthia. I also want to dedicate it to my mother, who poured all she had on her children, with much resiliency and sacrifice. Chapter 1. Introduction. We are living in odd times, given the current COVID-19 pandemic caused by the spread and contamination of the SARS-CoV-2 virus. A pandemic of this magnitude caused a third of the world's population to become infected with the H1N1 virus a century ago, in 1918, with an estimated 50 million more deaths when compared with mortalities of the First and Second World Wars. SARS-CoV-2 is an infection that can occur for 2 days to 2 weeks without symptoms in the human body and, in some cases, for the entire life of the infection. The COVID-19 pandemic tells the world a human death tale and medical supplies unavailability to rescue lives. Bookish, innovative ideas are discussed by most news outlets, social media, and medical workers to compensate for the lack of funding. For example, some healthcare workers have worn garbage bags in the absence of hospital gowns. One thing is undeniably real. Our healthcare professionals do not have personal protective equipment, PPE, in times of greatest need to protect themselves and provide patients with the best treatment urgently needed. Forecasts from the Center for Healthcare Metrics and Evaluation, IHME, have shown that there is still a shortage of hospital beds and therapeutics, even though adequate protection measures are pursued. It is an inconvenient truth that raises a challenging question. Why does the world experience such medical supply shortages to fight the COVID-19 pandemic? These shortages in most medical facilities and regulatory challenges affect the medical device industry and healthcare systems. Even though a few predicted it, the novel coronavirus pandemic seemed to have started by surprise. Once exclusive to the Chinese city of Wuhan, the epidemic has gone from a news headline to the talk of every country, media house, community, and professional debate. In a noticeably short period, it is being rated as the fastest disease outbreak in memory. Coronavirus has ushered market failures, where high demand for medical supplies is met with limited supply. It is now a competition for manufacturers and distributors to set new terms and...
Sample complete. Ready to continue?